Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut, and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me, or go over again, or are you okay with all this?
Question 26. Now read the question.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required, intramuscularly and given by Senior Nurse Bond.
Question 27. Now read the question.
So, that's all done. Was there anything you wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone, but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach 2 teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
Question 28. Now read the question.
Challenges, I suppose there's positive and, we have to look for the positives of that. For me, a big challenge really in terms of nutrition is that everybody eats and drinks, so everybody has an opinion on what they are eating and drinking, and athletes are no different than the general population. You can hear messages or stories or information coming across, and sometimes that information might be suitable for Joe Public on the street, but in terms of an athlete that's training twice or three times a day, that can often be a difficulty. And, factor in a couple of other things like, changes in body composition, trying to gain weight or trying to lose weight. Athletes sometimes struggle with those particular aspects of things and quite often sometimes want to go for the quick fix. And sometimes my messages are quite often the longer fix type messages, and that can be a challenge. So I suppose for me as a practitioner, the challenge for me every day is to make that message real. It's to make it suitable to the person that I have in front of me, but also it has to be relevant in terms of the science behind it. So sometimes the science doesn't really change, so I have to change the message or the way I adapt the message for the individual.
Question 29. Now read the question.
OK, we need to do our debriefing. Any comments about the case, Jackie?
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy in clinic this morning, but we were also delayed getting into this room because the case before us went over their time, which pushed us back. That's becoming a regular occurrence with that particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of their cases.
We were also slow to get the portable films from radiology. There were several rooms requesting films, and radiology seemed short-staffed. That's unusual for them, but let's keep an eye on that, and if it happens again, raise it as a concern.
Question 30. Now read the question.
In bed 12, we have Liam Ogilvie. Liam's a 45-year-old male who was involved in a motorbike accident and was admitted with a frontal lobe contusion. He's broken his right arm and hand and has had surgery, including metal plates inserted into his arm.
Right.
He's also got deep grazes on his left knee and ankle and stitches on his right leg and shoulder. All dressings have been changed this morning at 9 and he's on self-administered morphine drip as well as an antibiotic drip. He's had injections to prevent blood clotting and his pain's quite manageable with the medication he's on. The doctors requested some observation and testing regarding memory loss, so that's priority this morning. His right arm's in a cast and he'll need regular monitoring and a physiotherapy sessions booked later in the afternoon. Somebody's coming to collect him at 4. I've just checked his vital signs and he's stable with blood pressure at 135/95. It's a bit up, so you'll need to watch that.
That is the end of Part B. Now look at Part C.